we are now live. I'll just give an intro and I will start. Okay, ma'am. Fresh good afternoon to all of you. On behalf of Indian Medical College, I welcome all of you to this interesting session in anatomy. Today we have with us Dr. Mrudula ma'am. She is currently professor and head of department of Apollo Medical College, Hyderabad. She also has a feather in her cap as editor for the famous Chorachia book of anatomy. She will be delivering talk today on venous drainage of lower limb. I think you will all enjoy this session today. If you have any doubts, please type them in the chat section in the YouTube channel, and I will ask Madam to clear it for you. Okay. Ma'am, I hand over to you, ma'am. You can start the session, ma'am. You can share the screen and start the session. Thank you. Thank you. Ma'am?
Can I start the class?
You can start, ma'am. You're there.
Can I start?
You can start, ma'am.
Yeah.
You can start.
Yeah. Good afternoon, students. As you can see in this picture.
share the screen, ma'am. Share the screen, ma'am.
Sharing, sir.
Screen is not visible. Share the screen, ma'am. PPT.
Yeah, I'm sharing it.
No, ma'am. It's not visible to us.
Okay. Is it visible now?
Visible, ma'am. Now visible, ma'am.
Yeah.
Thank you.
Okay. So, good afternoon, students. So today we are going to discuss an interesting topic. But before going to the topic, if you see this image or this picture, what can you understand? So in this, a lower limb is shown. One side, it is a normal picture. And in one side, you can see there is some enlargement of some structures. So can you guess what is this? Yeah. If we go into that, this is a case of varicose veins. So today we are going to discuss one of the important things related to varicose veins. Now, what do you mean by varicose veins? The varicose veins is a clinical condition that is seen where the distension and dilatation of the superficial veins of the lower limb is seen. This is one of the common conditions which we can see in clinical cases. So to understand this condition, we need to know about the venous drainage of lower limb. So today we are going to discuss the venous drainage of lower limb under these learning objectives. So what are the different types of veins we have in our lower limb? What are the factors which are affecting the venous drainage of lower limb? The great saphenous vein, the small saphenous vein in detail, the perforators, the varicose veins, and the other applied aspects related to the venous drainage of lower limb. So, we're going to start with the topic. So, when we take the veins of the lower limb, we have basically three sets of veins for the lower limb. The three sets of veins include the deep veins, the superficial veins, and the perforating veins. So when we compare with our upper limb and the lower limb veins, there is a difference here. In the lower limb, we have a special set of veins called as a perforating veins. But in case of the upper limb, we have only two sets of veins, the superficial veins and the deep veins. But the difference here is the perforating veins which are connecting this deep and superficial veins. So first we are going to discuss about the deep veins. So like in upper limb, even in the lower limb, the deep veins are present along with the arteries. So if you see the veins, they are present along with the arteries deep to the deep fascia within the muscles. So if you see the arteries of our upper limb, the arteries of the lower limb, it's the external iliac artery which continues as a femoral artery, a popliteal artery which divides into anterotibial and posterior. Same here, the veins are corresponding along with the arteries. So we have an anterotibial vein, the posterior tibial vein, which join and form as the popliteal vein. The popliteal vein which continues as the femoral vein. The femoral vein which opens into the external iliac vein. So the deep veins are always accompanying with the arteries. But here one important feature we need to know. When we come for this terminal veins, that is with the anterotibial vein and the posterior tibial vein, the veins are not single, they are two in number, on either side of the artery, and that is called as venae committantes. So peripheral veins are always double and they are present on either side of the arteries. Now why do you have like this? Because the peripheral veins are comparatively thin than the main veins. So the pulsations of these artery will stimulate the vein and will help for the venous. But as it goes upwards, as it goes to the popliteal and femoral vein, we don't have such feature of venae committantes. So deep veins are accompanying the arteries and they are named as anterotibial, posterior, where they are present in the form of venae committantes, which join and form as a popliteal, which go and open into the femoral, then finally into the external iliac vein and proceed upwards. So these are the deep veins. Then we have our superficial veins, and the superficial veins are not accompanied by arteries. And these veins are just present within the superficial fascia, just below the skin, within the superficial fascia or subcutaneous tissue. We have this veins present. And further lower, we have two types of veins. One is the great saphenous vein, which is running on the medial side of the leg, and a small saphenous vein, which runs on the posterolateral aspect of the leg. So when we see the superficial veins, as we are mentioning, there are two types. One is the great saphenous and one is the small saphenous. The great saphenous runs on the medial side. The small saphenous vein runs on the lateral and posterior aspect of the leg region. But if you see the great saphenous vein, it's present throughout the lower limb, extends up to the thigh and ends in the thigh. So these are the superficial and deep veins. Now, when we come for our lower limb, we have a special set of veins present. And these veins are called as the perforating veins. Now, perforating veins communicate the superficial to the deep veins. As we all know, the veins will be having the valves. So always the blood flows from the superficial to deep because the valve direction is towards the superficial to deep and it's not in the reverse direction. And especially in the lower limb, when we come, we have a muscle called as the soleus. So within the soleus, these perforators, they form like a plexus or sinuses and they drain the blood from the superficial to the deep. So these are the special veins what we have in our lower limb. So broadly, when we come for the veins of the lower limb, we have divided them into the superficial veins, the deep veins, and the perforating veins. The superficial veins are again two, the great saphenous vein and the small saphenous vein. These two are present within the superficial fascia, just below the skin. The deep veins, they are present along with the arteries. They will be going along with the arteries as a femoral, the popliteal, peroneal, anterior and posterior veins. And as we told, the anterior and posterior veins will be double and called as venae committantes, and which will be helping for the venous routine. And the third group of veins what we have in the lower limb is the perforating veins. So these perforators are connecting to the superficial into the deep veins. So now we are going to go into the details of these veins. Now all these veins are provided with the valves, and these valves will prevent the backflow of the blood. And usually the blood goes from the superficial to the deep veins via the perforators. But only in the foot region, it is in a reverse direction. The blood will go from deep to superficial. Okay, it's only in the foot. Only in the foot region we have this different aspect. The blood goes from the deep to the superficial. But whole of the lower limb, the blood will be draining from the superficial to the deep. Now, there is a very important feature here. The venous region of the lower limb is very peculiar. Why it is important? Because most of the time we keep our lower limbs hanging. So always the blood should go against the gravity upwards. So this is one of the tasks what we have. When we come for the upper limb, we don't have any such problem because we are not hanging most of our upper limbs. But lower limbs, always the blood should go against the gravity. So what are the factors which are helping for this venous region? There are two important things what we need to understand here. One is the calf muscles. So what are the muscles which form as the calf muscles? As we know, one is the gastrocnemius and one is the soleus. So these are the two muscles which are present on the posterior aspect of our leg, and they are called as the calf muscles. So these calf muscles are acting like a peripheral heart, and they squeeze the blood upwards. So as you can see in this picture, the calf muscles, that is the gastrocnemius and soleus, within them we have these veins, and the contraction of these skeletal muscles will push the blood upwards. The second important factor which is helping for the venous return is the suction action of the diaphragm. So when we see the diaphragm, the thoracic diaphragm, which is forming a partition between the thorax and the abdomen, it contracts and relaxes. And when it is relaxing, it acts as a suction and helps for the venous return. So these two factors, the calf muscles and the diaphragm, will help for the venous return of our lower limbs. So we'll go into the details of the veins. So if you see in the foot region, there is something called as a dorsal venous arch. So the deep veins which are present in the foot, they communicate and open into the dorsal venous arch. As I told, in the whole of the lower limb, the blood goes from the superficial to the deep, except in the foot. So in the foot, it is in a reverse direction where the blood is coming from the deep to the superficial, and they open into the venous arch called as the dorsal venous arch. So this is the dorsal venous arch present on the dorsum of the foot. Besides these veins, there are something called as the medial and lateral marginal veins which form the sides of the arch. So from the lateral side. So if you see here, this is the dorsal venous arch which is present on the dorsum of the foot. Into this dorsal venous arch, the dorsal digital veins will come and open, and besides that, we have a medial and the lateral marginal veins which are open. So all of this will form a venous arch which is called as the dorsal venous arch. Now from this dorsal venous arch, from the medial side of this dorsal venous arch, we'll have a vein starting which is called as the great saphenous vein, and from the lateral side of the dorsal venous arch, we have a vein which is starting which is called as the small saphenous vein. So formation wise, on the dorsum of the foot, we have a venous arch which is called as a dorsal venous arch, and into this dorsal venous arch, we have the digital veins which are opening, and on the medial and lateral side, we have the medial marginal and lateral marginal veins will be opening. And this dorsal venous arch will extend on the medial side as a great saphenous vein, and on the lateral side as a small saphenous vein. Now we are going to discuss in details about the great saphenous vein. So when we come for the great saphenous vein, this is one of the superficial veins what we have on the medial side, and that will be running upwards up to the thigh. It starts from the medial side and goes up to the thigh. So when you see the medial marginal vein, which is on the medial side, will continue as a great saphenous vein through the dorsal venous arch. And this vein is considered as the longest vein of the body. So among all the veins what we have in our body, this is the longest vein of the body. Now coming to the course of this vein, the great saphenous vein starts from the medial side, from the dorsal venous arch, It extends upwards 2.5 centimeters in front of the tibial margin. This point is one of the very important surface landmarks. What is the importance? We are going to discuss when we go for the upper aspect. But here we need to remember the dorsal venous arch on the medial side continues as the great saphenous vein, and the great saphenous vein runs upwards, and the position of this will be 2.5 centimeters in front of the tibial line. It goes upwards, crosses the medial side of the lower 1/3 of the tibia. So when we see the tibia, it is on the medial side of lower 1/3 of the tibia. Runs along the medial wall of the tibia, and at the region of the knee, it goes to the posterior medial aspect. Till the knee, the great saphenous vein is running on the medial side, but when we come for the knee region, it goes to the posterior medial aspect of the knee. It runs upwards along the medial side of the thigh to reach the opening called as the saphenous opening. So we'll discuss the course again. So dorsal venous arch on the medial side starts and as a great saphenous vein. The great saphenous vein extends upwards on the medial side 2.5 centimeters in front of the tibial malleus, goes upwards, and in the lower part of the tibial region, it is on the medial side, and as it is extending upwards in the leg, it is on the posteromedial aspect of the knee. But in the thigh region, again it comes to the medial side and then reaches the opening called as the saphenous opening. Now, as we know, the saphenous opening is an opening what we have within the deep fascia, and this saphenous opening is present 3 centimeters below and lateral to the pubic tubercle. One of the surface marking what we need to know here again. So the saphenous opening is a modification of the deep fascia, which is present 3 centimeters below and lateral to the pubic tubercle. So our great saphenous vein, which is coming up to the saphenous opening, pierces the opening and opens into the femoral vein. So it finally drains into the femoral vein. Now this saphenous opening is covered by a fascia called as a cribriform fascia, which is again a modification of a superficial fascia. So we have to understand two things here. There is a saphenous opening, there is a cribriform fascia. Cribriform, the name is telling, cribriform is like a mesh mark. It's like a seed-like appearance, and this fascia is covering the saphenous opening. And cribriform fascia is a modification of the superficial fascia. And when we come for the saphenous opening, it's a modification within the deep fascia, and the position of the saphenous opening is 3 centimeters below and lateral to the pubic tubercle. So that is the course of the great saphenous vein. Now this great saphenous vein is accompanied by some structures. Now in the thigh, it is accompanied by the medial femoral cutaneous nerve, which is a branch of the femoral nerve. At the knee, it is accompanied by the saphenous branch of the descending genicular artery. The descending genicular artery is the terminal branches of the femoral artery, and that gives a branch called the saphenous. So this saphenous artery, which is a branch of descending genicular artery, accompanies the great saphenous. And in the leg and the foot, it is accompanied by the saphenous nerve. The saphenous nerve, which is again a branch of the femoral nerve, the longest cutaneous nerve, is accompanied in the leg. So these are the three structures which are accompanying the great saphenous vein. Any vein will have the tributaries. So the tributaries, what we have for the great saphenous vein, they are classified into 3 types. One, in the leg region or below the knee, in the thigh region, and at the saphenous opening. So we divide into 3 places. So in the leg or below the knee, in the thigh, and again in the upper part where it is opening into the femur. So if you come to the tributaries in the leg region, there are 2 tributaries. One is the posterior arch vein and the anterior leg vein. So these are the two tributaries what we have, the posterior arch and the anterior leg. In the thigh, we have again two veins which are forming the tributaries as anterolateral and the posteromedial. Now, when we come at the the saphenous opening, we have four veins which are opening: the superficial epigastric, the superficial circumflex, the superficial external pudendal, and deep external pudendal. And if you compare, these four are present along with the arteries, that is the branches of the femoral artery, the superficial branches. So they will be accompanied with the veins. So in the leg or below the knee, we have two as a posterior arch vein and the anterior leg vein. In the thigh, we have two, the anterolateral and the posteromedial. And just before piercing and opening into the femoral, this receives the four tributaries, that is the superficial epigastric, superficial circumflex iliac, the superficial external pudendal vein, and the deep external pudendal. So these are the tributaries what we have for the great saphenous. Now coming to the next vein, the superficial vein, that is the small saphenous vein. So when we come for the small saphenous vein, the small saphenous vein starts from the lateral side of the dorsal venous arch and joined by the lateral marginal vein. So from the lateral side of the dorsal venous arch, accompanied or joined by the lateral marginal vein, we have this lesser or small saphenous vein. Now this vein runs upwards and goes to the posterior aspect of the neck and ends in the popliteal vein. So when we come for the detailed course of this vein, it starts from the lateral side, runs along the lateral aspect of the tendocalcaneus. Now what do you mean by this tendocalcaneus? Tendocalcaneus is a long tendon which is formed by the three muscles, that is the gastrocnemius, soleus, and the platans. So this is the tendon which is formed by the fusion of these three muscles and inserted into the calcaneum. So our small saphenous vein runs along the lateral side of the tendocalcaneus and goes up. And in the middle, it goes completely to the back side. As we started, it is on the lateral side, but it goes on to the back side, runs in between the two heads of the gastrocnemius and goes upwards and pierces the deep fascia and opens into the popliteal vein. So the great saphenous goes up to the level of the thigh and opens into the femoral, but the small saphenous is running only in the leg region. It is not extending into the thigh region and opens into the popliteal vein. Most of the cases it will be like that, but in very few cases it can extend, hardly 5 to 10%. But most of us will have the popliteal vein terminating, the small saphenous vein terminating into the popliteal vein behind the knee region within the popliteal fossa. And when it is piercing the deep fascia, we don't have any special opening or any big marking present for that. It's just pierces the deep fascia and opens into the popliteal. Now structures which are accompanying the small saphenous vein, in the lower part, there is a vein called the sural nerve. This sural nerve will accompany the small saphenous vein, and in the upper part of our leg region, we have a posterior femoral cutaneous nerve of the thigh. This will be accompanying the small saphenous. So two structures which are accompanying in the foot region or in the lower part, we have the sural nerve, and in the upper part of the leg, we have the posterior cutaneous nerve. So these are the two superficial veins what we have, the great saphenous vein and the small saphenous vein. So as we told, the great saphenous vein starts from the medial side of the dorsal venous arch, from the continuation of the medial marginal vein, runs upwards, goes into the thigh, pierces the saphenous opening and opens into the femur. And from the lateral side of the dorsal venous arch, along with the lateral marginal vein, we have the small saphenous vein extending upwards, ends into the popliteal vein in the popliteal fossa. So this small saphenous vein is not coming into it. Now, we have a special set of veins what we have in our lower limb, as we told, called as a perforators. So these perforators are communicating the superficial to the deep. So full leg region, if you take the whole of the lower limb, the blood always goes from the superficial to the deep. Except in the foot, we told in the start, in the foot, the blood is going in the reverse direction. It goes from the deep to the superficial. But otherwise, we have special veins called the perforators, which are connecting the superficial to the deep. Now, these perforators are of three types for us. One is a mid-hunter perforator, which is present in the thigh. One is a knee perforator, which is present in the knee region. And the ankle perforators, what we have in the leg region. So, hunter perforator is present in the thigh. The knee perforator is also called the Dodds perforator, which is present in the knee. And we have perforators at the region of the ankle within the leg, 3 on the middle side, 1 on the lateral side. And these are all the perforators. We need to know the position of the perforators. And why we need to know the position of the perforators? Because sometimes there is a condition called as ulcerations. When varicose veins will be there, the veins will enlarge so much and sometimes they rupture, and usually this rupturing is present only at the perforator. So we need to know the positions. So first coming to the thigh perforator, which is also called as the mid-hunter perforator. The mid-hunter perforator is connecting the great saphenous with the femoral vein in the hunter's canal. I hope we know the hunter's canal. So hunter's canal is also nothing but the adductor canal, which is present on the medial side. And why it's called the hunter's canal? Because John Hunter is a surgeon who has done surgeries for the aneurysms of the popliteal artery through this canal. So we have the first perforator in the thigh, which is called as a mid-hunter perforator. So this mid-hunter perforator is connecting our great saphenous with the femoral vein within the middle. It is in the hunter's canal in the middle of the thigh. Then we have the next perforator, what we have in the knee region. And this perforator connects the great saphenous with the posterior tibial vein. It's just around the knee level. So this is called as a knee perforator. Then we have the ankle perforators. So when we come for the ankle perforator, we have the perforators on the medial side. We have one perforator on the lateral side. The medial ankle perforators are 3 in number, and these medial ankle perforators connect the great saphenous with the posterior tibial vein. The lateral ankle perforator is connecting the short saphenous with the peroneal vein. So as we know, as we are telling, the medial ankle perforators are 3 in number and the lateral ankle perforator is only 1 in number. Now we should know the position of these perforators again. Now when we come for the medial ankle perforators, I am showing you the position of the medial ankle perforators. The whole of the leg, the lower part, this part, is divided into 3 divisions. From the level of the malleolus, that is the medial malleolus, till the level of the knee, we can divide into 3 parts. The lower part, the middle part, and the upper part. So the first perforator is present at the junction of middle and lower 1/3 of the tibial position. That is, if you divide the whole of the leg into 3 parts, upper part, middle part, and the lower part, the junction between the middle and the lower part, there we have the first perforator. The last perforator is present at the medial malleolus, and the second perforator is present at the junction of both of them. That means the leg part is divided into 3 quadrants: the lower, the middle, and the upper. So the first perforator is present at the junction of middle 1/3 and lower 1/3. So if you take the whole of the leg like that, upper, middle, and the lower, junction of middle and the lower, we have one perforator. The malleolar level, we have the other perforator. between these two, we have the second perforator. So there, all the three perforators are present in the lower part of the tibia. They are not present in the upper part. So that is the position of the medial angle perforators. Now, when we come for the lateral perforator, we have only one lateral angle perforator, and this lateral perforator is present at the junction of middle and lower one-third of the leg. So this is present at the junction of middle one-third and lower one-third. So this lateral perforator is connecting the small saphenous or the short saphenous with the perineum. And the medial angle perforators are connecting the great saphenous with the posterior. So these are the different perforators that we have. So what is the function of the perforators? The perforators are always taking the blood from the superficial to the deep. And as we told, we have one perforator in the thigh called the mid-under perforator, one perforator at the region of the knee called the knee perforator, and then we have the ankle perforators, 3 on the medial side and 1 on the lateral. So these are the different perforator positions what we have in our lower. So we have seen 3 sets of veins. The first set of veins, that is the deep veins, and the deep veins are present along with the arteries, and these deep veins will be carrying the blood upwards, and they are present along with the arteries as the femoral, the profunda femoris, the popliteal, and the peroneal. The superficial veins, we have 2, that is the great saphenous and the small saphenous, and the perforators. So now we are going to discuss about the applied aspects of these veins. Now why we have done so much is we have some clinical importance for these veins. And the most common applied aspect what we have for these veins is a varicose. And as we told, the varicose veins is a clinical condition where the superficial veins are getting enlarged. So here, there are 2 things we need to understand here. There may be the enlargement of these superficial veins maybe is because of 2 reasons. 1, the valves are not working. 2, the perforators are not. Any of this can cause a problem, that is the varicose. And the most common things that causes what we tell for disease, one is the thrombus formation within the deep vein. What is the thrombus? Thrombus is not nothing but the blood clots what we have. So within the deep veins, the thrombus formation may be present. And in whom this is seen commonly, people who are bedridden for a longer duration, who are not walking, who are not moving their lower limbs, they may be prone for this thrombus. The second reason for varicose veins is the increased intra-abdominal pressure. So if a person is having a big tumor in the abdomen, or if a female has a multiple pregnancy, like doublets or triplets, what happens? There is an increase in intra-abdominal pressure. The venous return will not be very easy. And the most important cause is the incompetency of the valves. So if the venous valves are not functioning properly, we can have this clinical condition of varicose. So, as I told, there are 2 things the varicose veins can occur through. One is the incompetency of the valves, and the second one is the problem within the perforators. Now, to identify what is the problem, whether it is the problem within the valves or within the perforators, we have a test present, and let's call it the tourniquet test. It's also called as body Trendelenburg test. I hope you have heard this word of Trendelenburg. There is something called the Trendelenburg sign also, but this is the Trendelenburg test. Trendelenburg sign is related to the gluteus medius and venous, but this is a Trendelenburg test. It's also called the tourniquet test. Now, what we do in this test, here we are doing this test mainly to rule out whether the problem is there in the valves or whether the problem is there in the perforators. In any of this, we can have a varicose veins. Now, what we do in this condition, we make the patient lie down on a flat surface, as you can see in this picture. We lift the lower lip and try to empty the veins. That means we try to push the blood and try to empty the veins. Then At the region of the inguinal region or in the upper part of the thigh, we tie a tourniquet. Tourniquet is a ligature which can be used for stopping the venous rhythm. So we tie a tourniquet, and then here we have to know two things. Now we make the patient stand with the tourniquet, without a tourniquet. First, we'll understand here there are two things. We make the patient stand with the tourniquet in. That means we make the after emptying the valves. So we make the patient lie down on a flat surface. We lift the lower lip and try to empty the veins by pushing the blood. Later, we tie a tourniquet at the inguinal region or in the upper part of the thigh. Then we make the patient stand. With the tourniquet, if the veins are getting enlarged, then the problem is in the perforators. Here in this picture, the tourniquet is removed and the veins are getting enlarged. Then the problem is in the valves. So how to understand this concept is, see, here in this case, the tourniquet is tight. So what is happening? We are closing the great saphenous vein here. So here, if the veins are getting enlarged, that means the perforators are not working properly, because normally what is happening, the blood will go from the superficial to deep, and from deep it goes upwards. So valves in the perforators direction is from superficial to deep. But here we tie the tourniquet, still the great saphenous vein gets enlarged, means the perforators are not working. The blood is coming from deep to superficial, because the valves are not working properly. The blood is coming in the reverse direction. And in the second case, when we remove the tourniquet, then the veins are getting enlarged. That means the great saphenous vein valves are not working properly and the blood is going down. So this is how we need to differentiate whether the problem is in the perforators or whether the problem is in the great saphenous vein valve. So what is the thing? With the tourniquet, if the veins enlarge, then it is the problem within the perforator. Without a tourniquet, if the veins enlarge, then it is a problem within the valves of the great saphenous vein. So the great saphenous vein at the junction has a big valve, so all the full veins will have a big valve. So if it's not working properly, we have this reverse flow of blood. So by this body triangular test, we can identify whether the problem is in the perforators or the problem is in the valves. Now, what is the treatment for the varicose veins? In the initial time, we always tell the patient to keep the lower limb elevated position, and when in walking, he or she is supposed to use a drape bandage or the stocking. So what happens when you use this stocking or drape bandage? It puts pressure on this superficial veins and prevent the backflow of blood. And if neglected, actually, if neglected, the varicose veins are neglected, then we have a abnormality where we have an ulceration, as we told in the initial time of the class. So there will be a varicose ulcers will be forming, and these ulcers are more common at the position of the perforators. So initial treatment is a drape bandage on the stomach. The second treatment procedure which is done is called a stripping procedure. But this procedure is not done nowadays. It's a case of day-old procedure which is done. So what they do in this stripping procedure, via the saphenous opening, they pass a long wire through the great saphenous vein, which goes till the end. As you can see in this picture, it goes till the end, and they try to hook the great saphenous vein and try to pull the great saphenous vein completely. So here, what they are doing is they are removing the great saphenous vein completely. So when we remove the great saphenous vein, the varicose veins, the enlarged veins will not be there. But this is a day-old procedure which is not being followed nowadays. So that is the two things what they do for the varicose veins. Now the great saphenous vein has other clinical aspects also present, that is commonly used for a bypass operations for the aortic coronary bypass surgery. So again, this is a day-old practice where the great saphenous vein is being pulled and that will be kept in case of the coronary artery blockages. But nowadays we also have an arterial bypass grafts done, but day-old time we have this bypass surgery. The other important applied aspect of this vein, that is the great saphenous vein, is a venous section. Now, when we told the course of the great saphenous vein, if you remember, we told the great saphenous vein is 2.5 centimeters in front of the medial malleus. I told this has a clinical importance present. So, what is the clinical importance is the venous section procedure. So, what do you mean by this venous section? So, venous section is a clinical procedure which is done in case of a shock or any other problem where we need to give more IV fluids. So in that case, the great saphenous vein is commonly used and the tube or the IV tube what we use is directly kept inside the great saphenous vein. And as you can see in this picture, this is the medial malleus. 2.5 centimeters in front of this will have the great saphenous vein body. So they ligate the great saphenous vein and pass the IV catheter directly into the great saphenous vein. So in this case, what will happen is more amount of IV fluid will be passed. So it is done commonly in case of the shock where more amount of hydration is required for the patient. So these are the clinical aspects what we have for the venous range of volume. So in short, I will repeat the veins. So we have the superficial veins. The superficial veins are the great saphenous and the small saphenous vein. The great saphenous vein starts from the medial side of the dorsal venous arch, extends upwards in front of the medial malleus, goes up in the middle of the leg, goes on the medial side of the thigh, pierces the saphenous opening and opens into the femoral vein. Here we need to remember one point of the saphenous opening. The saphenous opening is 2.5 centimeters below and lateral to the pubic tubercle. The great saphenous opening is the opening what we have within the deep fascia, covered by the cribriform fascia, which is a modification of the superficial fascia. The small saphenous vein starts from the lateral side of the dorsal venous arch. It goes upwards posterolaterally, pierces the deep fascia and opens into the popliteal vein in the popliteal fossa. The deep veins are present along with the arteries and in the lower part or in the terminal part. Distally, these deep veins are present in the form of venae competentis. Why? Because the peripheral veins will be thin and the venous return will not be very much. So the pulsations of these arteries will help for the venous return. They will be antitibial vein, posterior vein, peroneal vein, which drain into the popliteal and into the femoral and finally into the external. And the third veins, the special veins what we have in our lower limb are the perforating veins, and these perforating veins are connecting the superficial to deep veins. So what we have for these perforators, we have a mid thigh perforator, then we have one perforator at the knee region, and then we have perforators at the ankle region. The ankle perforators, 3 are present on the medial side, 1 ankle perforator is present on the lateral side. So these are the different perforators what we have. So normally the blood goes from the superficial to the deep, and from deep it goes upwards. Except in the foot, the blood goes in the reverse direction. It goes from the deep to the superficial. So any abnormality in the perforators or in the valves, we have an applied aspect called as a varicose veins, where you have enlargement of this veins. So in the initial time, we need to know, differentiate whether it's a problem in the perforators or in the valves, and the treatment is usually the ligature of this veins and the trade bandages what we use. The other applied aspect is the venous section, which is done commonly through the great saphenous vein and the aortic bypass surgeries what we do. So this completes the topic of the venous range of the lower limb. Thank you. Any queries or anything, please message me.
Thank you, ma'am. Thank you. It was a wonderful and to the point with very good illustrations. I think students would have definitely understood the concepts well. Maybe
Thank you,
1 minute,
sir.
2, 3
Any
minutes we'll wait.
questions are there?
We will see, ma'am. 2, 3 minutes we'll wait for the chat section. If there are no doubts, then we can move on, ma'am. And
Okay.
meanwhile,
There are no doubts, I think. Just a message came. Thank you.
wait, one announcement regarding the next classes I'll just make. Friends, till then, please share our YouTube channel. It's tinyurl.com/Indian Medical College 2020. Share our Facebook page where the announcements of future schedules will be available. These videos will be available. fb.com/Indian Medical College 2020. And we have upcoming session, a good topic on typhoid. It's a microbiology section, 5 to 6 p.m. And 6:30 to 7:30, we have another good session. It is A to Z on ECG by Dr. Swami. Stay tuned. Tomorrow also we have a biochemistry session on free radicals and antioxidants, 3 to 4 p.m. And commonly asked doubts on blood transfusion at 5 to 6 p.m. And examination of the pupil tomorrow at 6:30 to 7:30 p.m. ophthalmology session. So I'll just check the chat section, ma'am, if there are any doubts. That's it, ma'am. Maybe our Zoom participants, maybe 1 or 2 questions you can ask, ma'am.
So usually for the first year students, commonly asked questions from this topic is full venous range of lower limb is commonly asked as an essay question. And besides that, they also ask the great stiffness pain commonly as a short question, because one of the common clinical aspect what we have is a varicose vein. So the students need to know about the great stiffness vein details under the headings of how it is formed, what is the course, what are the structures accompanying, what are the tributaries, and what are the upland aspects.
It's a wonderful, I think to the examination also, it will be very useful. Ma'am has shared all the important questions for you all. We will have definitely more sessions, ma'am, with you.
Thank you.
So
Thank
that
you.
will benefit. Thank you, ma'am, for we will wrap up the session. Thank you very much, ma'am. Thank you. Thank you. Thank you all.